Welcome to our podcast, Making Clerkship Click, with your hosts, Tanmay, William, and Nick. If you're a medical student, this is a podcast just for you to get quick and easy primers on high-yield medicine topics that you're likely to come across when you go through your clerkship blocks. So let's dive right in.
Welcome to our new 5 minutes or less series here on Making Clerkship Click, where we provide rapid overviews of basic medical topics to make you a superstar on the wards. Our first episode comes from the field of trauma management. Today we'll be reviewing the primary survey, the initial part of the assessment of a trauma patient.
As a clerk, you'll likely see a trauma at some point in either your ER or surgery rotation. And while you may not be directly involved in providing trauma care as a clerk, it is important to understand what is happening and the approach that is being used. And that is where knowing what primary survey is and the steps of a primary survey is important. Now, the primary survey consists of 5 components, and remembering those components is easy. Just remember the alphabets: A, B, C, D, E.
Wow. The first step is airway maintenance and C-spine protection. So if the patient is talking, their airway is probably protected for now. However, if you're gurgling or stridor or see a bucking, rocking chest, you have to act. Airway management options exist on a spectrum, from really simple maneuvers like the jaw thrust to intubation, and even the creation of a surgical airway as a last resort. Now, it's really important to assume every patient involved in trauma has a fractured C-spine until proven otherwise. Just put them in a C-spine collar. You can get imaging to confirm or rule out a fracture later, but it's smart to protect them for now.
Moving on to B, which is for breathing. Once you know your patient's airway is secure, you want to assess their breathing. With this, you want to ask yourself, what's their respiratory rate? What's their oxygen saturation? How does their chest wall look? Is it moving equally on both sides? And when you auscultate with your stethoscope, can you hear breath sounds? And finally, is their trachea midline? This stage is really important for identifying and then treating some life-threatening chest injuries. So things like tension pneumothorax, flail chest, massive hemothorax, or open pneumothorax.
So next is C, and that's circulation. Now, circulation can be assessed through various parameters. Check their blood pressure, heart rate, peripheral pulses, and capillary refill. Is there pallor? Are they getting sufficient blood flow to the brain? One quick way to screen for that is checking their level of consciousness. Hemorrhagic shock is by far the most common cause of shock in trauma patients, and prompt identification and hemorrhage control is essential.
Okay, so now we've covered circulation, we're going to move on to D, disability. So in this part of the primary survey, you do an exam to assess for possible head injury. It won't nearly be as long or as complicated as your full neurological exam. In trauma, you want to check both pupils for the size and reaction to light, looking for herniation, perhaps secondary to a bleed, and assess the patient's eye opening, motor response, and verbal response to calculate their GCS score.
Lastly, we have E, which is for exposure and environmental control. Here you want to completely undress the patient to look for any potential hidden injuries. Here you'll likely need to cut through their clothing, and after you've done this, you immediately want to cover them either with warm blankets or put some sort of warming device like the bear hugger. This is really important because it helps prevent hypothermia, which is lethal in trauma, and part of that lethal triad you probably reviewed earlier on in medical school. And that hypothermia worsens bleeding.
Now, finally, after your ABCDEs, you can get some adjuncts. These are tests that shouldn't get in the way of resuscitation, but are really, really nice to have. Now, adjuncts include things like pulse oximetry and blood gases, blood pressure monitoring, EKG monitoring, chest x-rays and pelvic x-rays, a FAST exam, which is basically a fancy ultrasound to assess bleeding, and finally, you can consider a Foley catheter to track outputs if there's no evidence of urethral injury.
So overall, the primary survey, as the name suggests, is meant to be a quick survey. It's a rapid screen to check for things that will kill the patient right away, life-threatening injuries. While ABCDE is a good memory tool, the steps are not necessarily performed in that exact fixed order. In reality, during a trauma, the different parts of the primary survey occur simultaneously, with different team members completing different tasks simultaneously.
Importantly, resuscitation, so starting an IV and getting crystalloid or potential blood products into the patient, starts while the primary survey is being completed, because you want to stabilize the patient first. Beyond that, these different components of the primary survey we've reviewed are repeated over and over as you manage the patient to assess for possible emerging issues over time. To finish, trauma management can be overwhelming as a clerk, but all you need to do is remember A, B, C, D, E, and you'll have a better idea of what is happening in front of you in this crazy environment. Thanks for listening.